Hello, my name's Greg Egan, and I'm a social worker with the Australian Association of Social Workers. Now, today I want to talk about the topic of exposure therapy and what it is. It's a cognitive behavioral therapy technique, and I'm going to get into it now. So, what is exposure therapy? It's a behavioral therapy technique that is often used in cognitive behavioral therapy to treat anxiety disorders, phobias, and other related conditions. The goal of exposure therapy is to help individuals face and overcome their fears by gradually exposing them to the feared situation or object in a controlled and safe manner. During exposure therapy, a person is gradually exposed to this feared situation or object, starting with a situation or object that is less anxiety provoking and gradually working up to more challenging situations. This process allows the person to gradually become desensitized to the fear and developing coping strategies for managing that fear, whether it be challenging unhelpful thinking patterns or mindfulness or many other strategies. Exposure therapy can be conducted in different ways, such as through Vivo Exposure, real-life exposures, imagery, through imagining the feared object or situation, or virtual reality exposure, using computer simulations to create a realistic environment for exposure. The type of exposure used depends on the specific phobia or anxiety disorder being treated and the preferences of the individual receiving the treatment. And again, these are just some examples of exposure therapy. Now, here's a little bit more detail on Vivo exposure. This involves directly facing the feared object or situation. For example, if you feared snakes, you may be placed in a situation where you have to handle snakes. If you had a social anxiety disorder, you may be taken to a party or an event or told to give a presentation in front of an audience. Personal example that I had when I was younger, I had a fear of flying. What was the first thing I did? Maybe silly, maybe not. I jumped out of a plane doing parachuting. But after that, I definitely had no fear of flying because I'd done the worst of it. Using imagery to actually work through your fears. This involves getting the individual to imagine the feared object or situation. If a person feared spiders, they may be asked to think about spiders or close their eyes and think about spiders. Or you have to do this with your eyes closed, for example, and imagine that you are in a situation where you use all your senses to expose yourself to that potential fear. So you're asked to feel, you're asked to hear, smell, taste, touch the particular feared item, for example. And of course, you wouldn't want to be tasting spiders. In some countries, they do eat them. So it's about imagining it and working through that experience with the therapist as you're imagining the spider, the feared situation, the feared object, for example. Virtual reality exposure. This involves using technology to help the person experience the situation, where Vivo exposure is not practical. So if you can't physically take someone to expose them to the situation, then you might use some sort of technology which helps them experience the sights, sounds, smells of a particular situation, like flying, attending a social event. Like you might use something like a flight simulator if a person had fear of flying. Other exposure therapy techniques, and these are just some other examples out there, is graded exposure, where the counsellor may start with less threatening situations and gradually increase the exposure to an object or a situation. So you might start off with imagining the situation, and now you're placed in that situation. Flooding, this is where the counsellor exposes the client to the most difficult tasks up front. And of course, that's not going to be good for everyone. Systematic desensitization, where the counsellor combines relaxation techniques whilst exposing the client to the various alleged threats that make them fear a particular situation or object. So whilst we're exposing you to the particular feared situation, we may be teaching you how to use mindfulness in those situations, how to challenge your thinking patterns in those situations, for example. Exposure therapy can be used, again, with a variety of conditions, including phobias, which is a type of anxiety disorder defined by persistent and excessive fear of an object or situation. Panic disorder, recurring unexpected surges of intense fear, discomfort that peak within minutes. Social anxiety disorder, sometimes referred to as social phobia, is a type of anxiety that causes extreme fear in social situations. Obsessive compulsive disorder, a condition that results in unreasonable thoughts or fears, obsessions that leads to compulsive behaviors. Post-traumatic stress disorder, a disorder in which a person has difficulty recovering or experiencing or witnessing a terrifying event or trauma event that they've gone through. Generalized anxiety disorder, severe ongoing anxiety that interferes with daily activities. So as you can see, this particular form of therapy, which is connected with cognitive therapy, uses a variety of different tools to help a person cope with their fears and their anxieties. And at the end here, I've just added some various references, which I will put in the description of in the channel so that you can link straight into them. But anyway, if you've got any questions on this, leave the comments in the comment section and I'll do my best to answer your questions. And thank you for watching. And if you like these sort of videos or you have any videos you'd like me to put up, leave comments in the comment section below and hit like, subscribe. And again, thank you for watching.